I was so, I guess you would say, upset by the fact that we had almost a near catastrophe with a machine that failed. This got me very much interested in effective training of our young doctors. My specialty, originally, I'm fellowship trained in neurosurgical anesthesia, and this involves putting people to sleep who are having brain surgery primarily, or surgery on their spinal column and spine. My experience in simulation really began with 3 critical incidents that I had in the operating room in real situations that could have harmed the patient. And in each one of those situations there was a problem with the anesthesia machine that had slipped the checkout performed by the young doctor who was in the room. I told my then chairman, Dr. Frank James, that I really wanted to launch a simulation center. We had funding approved for the PSL construction of the facility, and that was completed in 2000. We developed a second simulation facility with some funding that the Department of Surgery had, and expanded the patient simulation laboratory into the Center for Applied Learning. And other leaders in our medical center Dr. Johnson had pulled this thought together, that ultrasound, for example, and anatomy and anesthesia and surgery with laparoscopy, we could pull all these simulation silos together and make a center for applied learning. They built that second facility called the mock operating room and the CAL. And now we enjoy both simulation centers for the ongoing training of many of our physicians through the medical center. The American Board of Anesthesiology concurrently was thinking how they could incorporate standard training in simulation to handle crisis management. They wanted to incorporate that into their continuing medical education and make it mandatory. So in the recertification program, which is every 10 years called MOCA, they, by 2009 or 10, required this element of simulation training, and it had to be obtained in one of these certified centers that my committee established the standards for. And we now train doctors from across the country for their continuing education for specifically recertification of their board status.